So has there been anything new going on with your clients this past week?
Yeah, we had one client that we're helping. He has a software application that we're trying to get through U.S. clearance. We actually decided to go through this pathway called enforcement discretion. So I don't know if a lot of people know the FDA regulations around software medical devices, but also some of these low risk medical devices. FDA does something called enforcement discretion, which is kind of this middle ground between being a regulated device and not. Essentially the FDA says, yeah, we know these devices exist. They may qualify as a medical device, but we're not going to enforce our regulations on them. So they're discerning that they're not going to essentially regulate these products. And so what it means is that you essentially have a lower threshold of quality and regulatory documentation and testing and all that kind of stuff that you have to prepare. You can always do more for it, but essentially we help prepare one of these clients for enforcement discretion so they can start marketing their product. And it's been an interesting experience because FDA has essentially a policy that talks about this. It's called the Policy for Device Software Functions. And they go through the different rules that you have to fit into in order to be under enforcement discretion. And the big benefit is that you don't have to go through kind of like an official FDA review process, but I guess the downside is you still have to have some quality management system, processes in place, documentation, a technical file, that kind of thing. So you're kind of living in this weird middle ground of FDA regulations, but you can get to market a lot faster. So we've been helping him with that, and so he'll be ready to go probably by the end of next week and start selling his product, which is cool.
That's awesome.